Hello friends and welcome to my channel. Today we are going to talk about all the types of fractures that we know, starting from the upper extremity fractures. Now these are going to be 9 types: shoulder dislocation, rotator cuff injury, humerus fracture, nightstick fracture, Monteggia fracture, Galeazzi fracture, Colles fracture, scaphoid and boxer's fracture also. Shoulder dislocation, anterior dislocation, most common 95% of the time it is because of axillary nerve injury. All right. So coming to the treatment of shoulder dislocation, we use sling and swath. Next we have the rotator cuff injury, in which there is pain, weakness, and with abduction and external rotation of the humerus after fall on an outstretched arm. There is impingement syndrome, that is pain caused by compression of the soft tissues. It may be also present. And coming to diagnosis, it is mainly clinical. It can be confirmed using an MRI. We have to make sure that we don't confuse rotator cuff injury with adhesive capsulitis, because in adhesive capsulitis also there is significant stiffness of the shoulder, but there is only mild pain, and it is improved on movement. Okay. On rest, it is improved on rest. Coming to treatment, we give rest and NSAIDs for minor injury, whereas we go for surgery if there is a complete shoulder tear. Coming to humerus fracture, it is because of direct trauma. Radial nerve palsy may lead to wrist drop and loss of thumb extension in case of humerus fracture. Hanging arm cast versus coaptation splint and sling can be the treatment of choice. Next, we have the nightstick fracture, that is ulnar shaft fracture, which occurs because of direct trauma, often in self-defense against a blunt object. Treatment will be open reduction and internal fixation. Monteggia fracture, diaphyseal fracture of the proximal ulna and subluxation of the radial head. It results because of fall on the pronated and outstretched arm. Coming to the treatment, we go for open reduction and internal fixation of the shaft fracture, and also closed reduction of the radial head. Next we have the Galeazzi fracture. I call it the Colles fracture, which is mainly because of the radius diaphyseal fracture, and it is also associated with the dislocation of the distal radio-ulnar joint. It results from direct blow to the radius. Coming to treatment, we do open reduction and internal fixation of the radius. And next we have the Colles fracture, which involves the distal radius, often results from a fall on an outstretched hand, that is dorsiflexed, leading to a dorsally displaced, dorsally angulated fracture, which is also called as the dinner fork deformity, commonly seen in elderly and children. Next we have the treatment of Colles fracture is going to be closed reduction. There will be application of long arm cast. Next we have the scaphoid fracture. Scaphoid fracture, mostly it is the carpal bone fracture. It results because of fall onto an outstretched hand. It might take 2 weeks for the x-rays to show fracture, so we have to assume the fracture if there is tenderness in the anatomical snuff box. Treatment would be thumb spica cast. If non-union is present, then we have to do open reduction. With proximal third fractures, there are chances of avascular necrosis. Coming to boxer's fracture, there is fracture of the fifth metacarpal neck caused by forward trauma by a closed fist while punching a wall or punching a person. Treatment would be closed reduction and specular ulnar gutter splint, percutaneous spinning if the fracture is excessively angulated. So these were about the upper extremity fracture. In the next video, we'll talk about the lower extremity fractures. Till then, stay tuned. Take care. Bye-bye.